Hello doctors, welcome. Today's topic is going to be about luting cements. Luting cements are a critical part for any dental clinic success as crowns are considered one of the major bread and butter for every dentist, and every dentist would dream that their crown remains in a patient's mouth for 100 years. But reality is not there. Definitely there are some errors made by us during crown manufacturing and cementation, etc. That is not a topic for today, but something that can bring a small change is definitely luting cements. Generally we have a misnomer, and I too had the same misnomer, that if I use a luting cement which is more stronger or which is from a better company or which is expensive, then my crowns will not debond, my patients will not have complaint of crown getting de-cemented, etc. But that is not the reality. Okay, luting cements do play a part, okay, but that part is around 10 to 15%. Major of your crown success depends on your crown cutting, your retentive factors, most importantly your high point and occlusion by the patient, and many a times all this is right, but patient is doing unilateral chewing, excessive forces are coming, and if your crown cutting is ideal, then the crown can definitely debond, okay, or de-cement. So keep those points into mind. But yes, if you want everything to be accurate, then this 10-15% also plays an important part, and this is what we are going to help you out with to discuss this luting cements in a practical manner. We will not go about theory and classifications, etc. I'll inform you what is actually needed when you want to do it practically in real life. We will try to understand that, and I am very sure at the end of this discussion what I am using will be your understanding, and you will understand the logic behind it and the science behind it, most importantly. And as always, we will discuss everything in complete detail, and also the recommendations by us will be definitely economical. Okay, so at the end you will get all your questions sorted out for luting cements. So doctors, I am Dr. Tarun Mavadia from the Akshay Dental Academy. Let's begin. So doctors, in this topic regarding luting cements, we will first and foremost discuss what are some of the important qualities or properties that a luting cement should have. Now initial 4 to 5 properties are commonly known to us, but after that the remaining 3 to 5 properties which I am going to mention are most of the time misguided by us, or even not informed to us, or we are not just aware about it. Okay, so those are the very important ones when it comes to post-operative sensitivity and then food lodgements and all those type of complaints that patient have. Those properties can help us out. So we will first understand all the different properties that a luting cement should have. We already have GICs which are used for fillings, then why cannot those GICs be used for luting? Why there is a separate category required? So we will understand those properties. After we have understood that, we will try to understand what are in practical sense in these modern times types of luting cements that are available in the market which are related to us or relatable to us. I will not talk about old generations and all those things. I will talk about what are practically needed. We'll look at them, and then I will show you practical examples or brand names of each and every category so you get an understanding about it. And lastly, I will share my conclusion, and your conclusion also will be the same, why there is a particular type and particular you can call it a brand of GIC for luting that I prefer. Definitely this video is not sponsored by anybody. Okay, this is what I use. Okay, and this is what is our recommendation. Okay, and at the end I will show you a small video on unboxing of the product, and you can have better understanding what is provided under it. Okay, so the first topic is properties of a luting cement, and as you can see on your screen, the some of the important properties a luting cement should have are: number one, it should be stable. Now what do we mean by it should be stable? Basically, it should not react with any of the biostructures like enamel, dentine, with your ceramic crowns, adjacent gingiva all together. So this is common requirement for any dental material to be used. Second important property is it should be able to format a thin film. Now this is a very important property. This is why luting cements were separately created. your normal GIC fillings, they cannot be created into a small thin film. Why? Luting cements need to have this property so that they can spread everywhere around the surface area of your crown, and they can act as a mechanical lock and also provide a chemical bond of the crown to the tooth. So forming a thin film is a very important property, and this is what distinguishes a cheap quality luting cement with a good quality premium luting cement. Premium luting cements will have fine powders of it. When you mix them, everybody remembers that stringing consistency that was shown to us. Now generally we were thinking that when we do this string consistency, that it is more elastic, it means it is more sticky and it will stick to the tooth. Everybody will agree with this logic. But main logic behind that, why companies told people to do that, is so that you can correct that there is a thin film forming. You are able to stretch it into thin layers. That is the main logic behind it. Okay, basically what happens, there is a group of scientists who will do research for a company. Okay, and during the research they will come up with all these tricks. Then all this information is transferred to from R&D department to marketing department, and those scientists will not explain everything, but marketing department will then explain few celebrity dentists etc. that this is our product and these are the benefits. And as you all know, when information starts from A point and it reaches up to C, D, E, F point, then there is some variation in it, and that is what has happened over here. We are thinking that when we put this stringing stage, then it is more sticky and it will get chemically bond. It is not there. The purpose of the stringiness is to show us that there is a thin film forming, or it is a stretchable material. Okay, so I hope my point is clear. So second important property for a luting cement is it should be able to form a thin film, and that is why your posterior or class 2 types or your class 1 cavity filling GICs are not an ideal match for your luting type cements. Definitely you can do cementation with that. Some of my friends do it with them and they get a great success, but success is due to their good quality crown cutting, and many a times some of them have a habit of putting crown in zero occlusion. Patient comes to us to get the tooth repaired and prosthetic part. Patient wants to chew with it, but if you give a crown and now it is not in occlusion, then it does not serve the purpose. Different topic of discussion at all, but our second property is it should be able to form in a thin film. Third important property is easy handling. Now definitely we will want a such type of a material which can be mixed easily, which can be carried easily, and also it should not be much sticky altogether. Though when it comes to luting cement we cannot avoid it much, but still there are some specific contents in a luting cement that can help us to manipulate them better. Next important property for a luting cement is it should be good enough in a chemical bond. Definitely we would want our luting cement to have a chemical bond so that it can form a very good bond between the tooth and the crown. Okay, but this is not the major retentive thing that holds a crown to a tooth. Major retentive thing that holds a crown to a tooth is the angulations of the crown cutting or retentive factors of your crown cutting or your walls that are done. There are some additional retentive factors also which can be provided by us to give extra support to the crown to the tooth. And along with that, as I told you, occlusion, understanding of occlusion and high point correction, if all those things are accurate, your crown can have a great life or a long span of life. But definitely we will want some amount of chemical adhesion happening, so it should definitely have a chemical bond property. Next quality that a luting cement should have is it should be biocompatible. Okay, so now it should be body friendly, it should not create irritation, it should not create any other infection with the surrounding tissues. But this is one of the major disadvantage of GIC. It is the most irritant to gums. Okay, and that is why your habit of filling your crown completely with a luting cement and then putting it onto the crown, and then the luting cement oozes out and we feel so much happy, that is okay. But now a very important step comes, and that is cleaning this extra GIC. Okay, and no matter how much you try, you will not be able to clean everything everywhere three-dimensionally or surrounding the tooth. Interdentally cleaning is a problem. So you should try to modify your cementation or your luting process in such a manner that very little amount of material flows interdentally, and whatever material is flown in the interdental area at a right time when the material is slowly hardening. You should try to clean it with whatever means are available to you. Mostly flosses are used. Many a times Teflon tapes are converted into small floss type rolls and they are used, but this is an ideal method. Many a times doctors do complain that I have done a cementation, it is 6 months, now my crown has shifted back or food lodgement has started. That happens because of your extra luting cement that remains over there. And GIC, any type of GIC from any company, is one of the most irritant to gums. So whenever you are doing a filling that is below gingival level, and if it is GIC, it is bound to have recession at that point of time. So composites are the only choice. You will have to do them by any means possible. Okay. Next essential property that a luting cement should have is fluoride release property. Now this is not much of an important property, but if your luting cement can release fluoride, it can be helpful to the tooth. It can give anti-caries property to it. Okay, because it is not going to be majorly in contact with extraoral structures, but still if you can get extra property, that's all. Basically this fluoride release property will help to fight with post-operative sensitivity, especially in a vital tooth. So if something like that, it is not a major component to what you can call counteract your post-operative sensitivity. Okay, there are many other factors like water flow during your crown cutting, heat damage provided, using new burrs, using or doing right amount of crown cutting. All those are the major factors that control your sensitivity, and still you are bound to have some amount of sensitivity when you cut a vital tooth. Okay, so now you control it by using desensitizing agent and any means possible by yourself, and you can control it. But yes, if your luting cement can have a fluoride release property, it can up to some extent help you with post-operative sensitivity too. Now these are the commonly known factors that we consider, or generally companies consider, whenever they design a luting cement. But this was not enough. Okay, and this is not enough for modern lifestyle and modern type of food habits, where all the different types of liquids and soft drinks have increased. Okay, sleeps and etc have decreased, and all those things are creating a lot of problem for the body to cope up. So now some additional good properties that are required, and which are my important factor when I have decided this luting cement for us, or at least for all the participants of my academy, and what I myself use at all my clinic. Okay, then these important properties are: number one, it has to be economical. Now everything cheap cannot be good, I know that, but it has to be best cost effective. If I'm spending 3,000 rupees, I should get worth of 6,000. That is what my definition is of economical or cost effective. So definitely our material has to be cost effective for sure. Next important and very important property is it should be insoluble to water. Whenever you do a luting with any cement, you are going to have clavicular fluids coming from your gingival area or gingival sulcus, and there are going to be additional fluids moving around in the oral cavity. So now GIC is bound to get soluble, and this is what leads to debonding of your crown, along with the solubility of water and occlusal loads coming onto your crown. At some point of time, because of constant micro leakage and seepage of liquids, your GICs become soluble and your crown gets decemented. Okay, so now if you have a cement which is less soluble in water or impermeable to solubility in water, then you can have a better life of the crown, because micro leakage will not happen, and this is one of the important factor to avoid decementation of your crown. So definitely you need a cement which is insoluble to water. Next important property that a luting cement should have is it should be resistant to leakage. Definitely when your cement is impermeable to water or not soluble in water, then definitely it will be impermeable to leakage. So that is additional benefit of insolubility to water. Next important property a luting cement should have is it should have a very good marginal stability. What do I mean by that? That it should have a very good strength. Okay, at the margin area where the luting cement is at a very thin consistency or very thin amount, it should be stable enough to stay over there and it should not crack up. Okay, so it should have a very good marginal stability. And last important point is it should not have major post-operative sensitivity. Many a times there are some type of luting cements which will cause irritation, especially in a vital tooth. Then those type of acids etc should not be used. Most probably polylytic acid is the type of acid that is used with liquid in GIC to give a soothing effect to the tooth, but some companies may prefer some other agents to give it more shelf life and etc. So it should not have major post-operative sensitivity. So doctors, as you can see on your screen, these are all the properties that a luting cement should have. Every point has its own reason, and when all these factors come together, you get a ideal luting type of cement for your patients. Now moving further, doctors, my next topic of interest is then what are the different types of GICs that are available in the market practically, and which one we should select. So doctors, as you can see on your screen, the first and very common type of luting cement that is available are glass ionomer cements. The second commonly available luting cements are RMGIC, and that is resin modified GIC. Please keep in mind, this resin modified GIC are especially for luting. There are resin modified GIC also available for restorative type, but we are talking about resin modified GIC that are for luting. And the third main category in luting cements is only resin cements. Now again, resin cements can be divided into two parts, and that is adhesive type of resin cement and self-adhesive type of resin cements. Doctors, the GIC type of luting cements can be cemented. They are mostly in powder and liquid form. Similarly, RMGIC type of cements are also used as a method of cementation, and they are also in powder liquid form, and some of them are available in clicker form also. When it comes to resin based luting cements, they are available as I told you, adhesive type and self-adhesive type. Then adhesive type resin based cements have to be etched and bond, so there is a bonding process required, and this type of cements are generally used for lithium disilicates, any type of lithium disilicate processes, that is can be veneer, crown, inlay, onlay, endocrown, whatever it is. And self-adhesive type of resin cement is especially used for zirconia crowns. Okay, now we will discuss minor properties of them, okay, and then we'll come to a conclusion. According to me, and what I use is RMGIC. Okay, why is that so? See, normal GIC is soluble in water, so now micro leakage and post-operative sensitivity etc. will definitely be present, and that is the reason resin is added into GIC, and that is why they are called as an resin modified GIC. Whenever resin is basically added into any material, it increases its property of insolubility with water, so they will not get dissolved. Their biodegradability, the biodegradability is body will start trying to dissolve them, then that property decreases a lot, so they remain stable at their place for long period of time, and that gives a better success to our crown, and it makes it impermeable to all micro leakages and other problems that come along with solubility of material. So that is why resin modified GICs are my choice altogether. But when it comes to strength, normal GICs have a very low strength. Resin modified GIC has good strength, and only resin based cements have greater strength. But now problem with resin based cements are they are either adhesive type where I have to do etching and bonding. Okay, now that increases my step, and it is not necessary for my normal PFM crowns or every type of zirconia crown altogether, so that is not applicable, and that is why self-adhesive type of resin cement were developed. But now self-adhesive type of resin cement is not as strong as my resin modified GIC. Okay, and also it is 2 times more expensive than that, and it is available in a clicker form. I would say 80% of dentists are trained to use powder liquid when it comes to luting, and we form a natural tendency with it. So whenever you have to use a clicker form etc., we find it little bit difficult to manage. Not a rocket science altogether, but still, if choices are given, you will always prefer powder liquid. Okay, so now if you can get same all the properties that are available in self-adhesive type of resin cement are present in resin modified GIC. But now if it is economical, 50% less in price, and you get double quantity, so actually it is just 25% the price of it. Okay, and you can get better strength out of it, then I think that is a superior one. When it comes to only strength, the self adhesive type of resin cements is little bit weaker than RMGIC, but the most strongest of luting cement you can call is adhesive type of resin cements. But problem with that method is we will have to do etching and bonding, and that is not required with PFM and zirconia crowns. That is only required with lithium disilicate crown. Okay, so I hope now in your mind you have a picture. You have normal GICs which are powder, liquid and mixed. Problem is they become soluble with water and then they are weaker in strength. So that is why resin is added to this GIC and it becomes resin modified GIC. It has all the properties that we need. Okay, it is insoluble in water, fluoride release, and all the properties that we need are present. But still, is there something better than that available? Then yes, resin cements are developed. Resin cements are of two types: adhesive type, which will need etching and bonding. Those are necessary for lithium disilicate, anything that you do with lithium disilicate. And another type of resin cement is self-adhesive type, okay, which is specially developed for zirconia. But I have been luting zirconia crowns since more than 10 years with my resin modified GIC, and if you use right protocols to do it, you will not have any problems with it. Okay, so if you want something best for zirconia, it is definitely self-adhesive resin GIC. Okay, but I am doing it with resin modified GIC and I am having great success. I have a track record of more than 10 years of using the material, and nothing can beat a practical experience and practically done at a clinic things. Okay, so I hope you get this. Now there are some other types of temporary cement, luting cements also available, eugenol free, and I am not going into those details, but these are practically for your permanent prosthesis. These are the types of cements that are practically available right now, and I have not skipped on any part. So this is the basic information you need to have. Okay, so now you all know that my choice is resin modified GIC. Now I will show you some examples or practical brand names related to every group which are available, so you can be made more familiar to them. Okay, so now as you can see on your screen, the different types of GIC are: the most famous one from DTech, okay, the most economical one. Then a medium range from Neo Oricam, okay. This is a medium range from Medicept Extra Lute, and this has become choice of most of the dentists because very recently, before 6 months to 8 months, there were huge stock problems with our what you can call most preferred and golden standard GC1. So I think many people shifted to this, okay, and this is also a normal GIC type of luting cements. Our next product is definitely the golden standard GC1, okay, and this is something new that is on your screen. Now what makes this GC1 stand out compared to other? If others are also GIC, only GIC, and if GC1 is also GIC, what stands out unique in it? Then GIC or GC1, okay, has one additional material, and that is strontium, which is added to it and which gives it better stability. Not as great as resin, but it still gives it better stability, and that is why it is the common choice of every dentist when it comes to cementation. Okay, definitely it is a golden standard, and now they are available freely, so you can stick to it. But still remember, it is not as good as resin modified GIC. So whenever necessary or whenever must, you should try to go with resin modified GIC, especially when your height of the crown or abutment is less, when the patient's occlusions are odd, etc. When patient has repeated complaint of decementation, then definitely resin modified GIC can have little bit of better edge compared to GC1. Okay, and also the thing is, mixing ratio of GC1 is little bit different suggested by company. So for the people who are using GC1 in a very liquidy consistency, you might have some instances of debonding, but if you are using GC1 in a consistency that is somewhat comparable to a flowable composite consistency, then you will have a better success thing. Okay, so this is the extra benefit in GC1. It has strontium added to it compared along with GIC and all the necessary components, so it makes it more unique. So similarly to this GC1, DTech has come up with a new product, and as you can see on your screen, this is DTech Plus, and it also has a strontium added to it, so it makes it equivalent to GC1. Now I practically have not tried out the DTech one, okay, because I would not like to take a risk when it comes to cementation. Okay, I've taken all my experiments and risk earlierly. Now I cannot afford it, so I have not used practically. But what name suggests is it. So if you want to give it a try, okay, then you can definitely give it a try. Otherwise, GC1 is always there. But now GC1 will not have as good strength as your resin modified GIC will have. GC1 will not have as major stability with what you can call micro leakages as your resin modified GIC will have, and that I have experienced by myself. Okay, many a times my patient comes with a crown that is debonded, not very recently, but they will definitely come. Sometimes when the patient has chosen a metal crown, when I started my practice for initial 5 years of my practice, I was forced to do metal crowns also in some cases, but later on I understood that it is not for everything, and I stopped doing them. But still many a times we have to change them, and patients wishes are to be done. At that point of time my social economic status was also not great, so any job is a good job for me, and I was doing them. Later on I understood, so I started dropping down on metal crowns very drastically, and almost practically we don't perform them until and unless very less occlusal space is available, but still it is manageable now. Okay, so I have to cut those metal crown, and then we see, when we try to just move a probe in the inner area, the GC or the luting cement will flake out. And you can also try this out. Whenever your patient comes with a crown which is de-cemented, you can take a probe or a tweezer and try to scrape it inside the crown. If the GC or the luting cement is coming out as a powder form, it means micro leakage had occurred and material is not that much insoluble to water. Okay, so now if you are using GC1, you're happy with it. I myself also was using GC1 for long period of time. Okay, but then because of my academy, I have to try out every material, and I come across this and I found good results with it. Okay, and it is equivalently great. So whenever you find troubles with GC1, I would recommend you to have this with you. Okay, and it will act better with your zirconia crowns also. Okay, so that is my recommendation to you, and especially this was more needed when GC1 what you can call stock problems were happening. Okay, unfortunately I was not able to make this video at that point of time, but all the members who are part of our We the Dentist community, they all get the news early and all the happening things, so they were aware about it, and many doctors have shifted to it, and nobody has yet complained about it. This is about your normal GIC. Now let us have a look at some brand names related to resin based luting cements. There is first category, and that is adhesive type of resin based cements, and as you can see here, number 1 from Prevest, it is the most economical option that you can have when it comes to adhesive type resin type of luting cements. And in the bottommost part, the Variolink, which is available from Ivoclar, is one of the golden standards when it comes to bonding your veneers or any lithium disilicate. And similarly on the counterpart, the 3M Ultimate is also equivalent good contender of this slot. Okay, I like to go, when it comes to adhesion, I would like to go with 3M, so I prefer 3M Ultimate. Okay, it does not mean that Ivoclar is not bad or is not good. It is equivalently good, but if you know the steps or if you know ideal process, then Ivoclar has 1 or 2 additional steps and 1 or 2 additional material required, while 3M does not need it. So that is my choice of when it comes to bonding process. I would like to go with 3M, but when it comes to composites, Ivoclar is my first choice, and bond also at that point of time, 5th generation is Ivoclar. I have my own logics behind it. Okay, if you are aware or if you are regular with our channel, then you know that we conduct free composite course. There we have explained every generation of bond and what are the bonds that are necessary for you. You don't need to buy every type of generation. Okay, and we have explained those things in detail, so take benefit of it next time whenever our composite course is available. Okay, it will be available for free on January 2025 for one or 2 months, so make sure to be present. Okay, moving further, so this is our resin based or resin luting cements, and that is adhesive type. Next is self adhesive type, and here I have only one option for you, and that is U200. 3M company has specially designed this U200 brand especially for bonding zirconia crowns to a tooth. Okay, so if you are facing problems with zirconia crowns, U200 can help you out, but still you need to know the right process of bonding, what type of zirconia crown you have to get it processed. Okay, you have to get it sandblasted from inside. When you do the trial of it, you have to clean the inner surface. You can never etch zirconia crown. You have to clean it with sodium hypochlorite from inside, so all the salivary proteins are cleaned out. You dry it all together and then you do the cementation. But again, problem with this method is this adhesive type of resin based luting cement is not as strong as resin modified glass ionomer cement option that we have, and also it is 2 times more expensive, and number of cases can be done is half of what that material can do. So it is actually 4 times more expensive than our resin modified glass ionomer cement. Okay, but still you should be aware about it. As you can see in the picture, it is available in a clicker form. Okay, now next or last topic is our resin modified glass ionomer luting cements. Under this resin modified glass ionomer luting cements, one of the most famous and well-known brand is Relax, which was the first contender by 3M under this category. Okay, but very few people are aware that it is available in powder and liquid form also. Stocks are very rarely available. Okay, both the materials are almost same, but one is available in a clicker form, another available in a powder liquid form. If powder liquid form is available, it's okay, otherwise clicker form is definitely available. Problem with this is it is little bit expensive. So now there are some good quality economical options also available from some very good brands, and that brings us to our preferred choice. And my preferred choice of resin modified glass ionomer luting cement is from Sofu, and the brand name goes like high bond resiglass. So it is a resin modified glass ionomer cement type of luting cement, and it has all the properties that we need in a luting cement. Okay, and one packet of this will cost you anywhere between 2,800 rupees to 3,000 rupees. We have worked out a deal with some dealers, and we have listed it down in the description box. Please have a look at it at the description box. And we are trying to do this with almost every material available. Whatever dealer can give us a good deal and lowest prices, those are made available to you. And to get good and better deals on materials and something most happening in the dental community, you need to be part of our We the Dentist community. It is the most happening dental group right now on WhatsApp. Definitely being part of it is free, but whenever you will be wanting to be a part of it, the link is shared in the description box, the WhatsApp link. You have to click on it. It will ask you to send us a request. Once we will receive your request, you will get a DM from my number, official number, which is mentioned in the description only, and you will have to give us a proof that you are a dentist, and you have to comply to the rules of the group. Once you do that, you will be part of our community. There are so many events and things we are doing for dentistry under this community section, so do be part of it. But you will have to complete the KYC for it, and only dentists are allowed as a security feature. We don't want every type of people to be a part of it. Okay, so those are the reasons for having these steps. Coming back to our point of discussion, so that if you want some current deals regarding dentistry, which we regularly post, and we try to work out to get good quality materials from good dealers, original ones at a most economical price, then you can definitely be part of our community. Okay, so doctors, the secret is out. My choice of luting cement is from Sofu. Okay, high bond resiglass, and it works fine. It is a resin modified glass ionomer type of cement. It serves all the property. Okay, and you have to utilize it. Now what difference will it make? Then it is impermeable or insoluble to water. It is a fluoride release type material. It forms a very thin film. It has a very good strength. All the properties that I've discussed are satisfied by it. Okay, but still, if your high points are not corrected properly, if your crown cutting does not have proper retentive factors, and if you are not removing excess cements, then you can still have a problem. No luting cement or even resin based luting cements will not be able to help you out. Okay, so definitely you will have to improve your skills. Okay, and one thing that I have noticed is that if you are a dentist and you are practicing dentistry since, let's say for example, 1 year, 2 year, 3 year, 5 year, and if you are still facing problems with crown cuttings and root canals and other type of things, then you are the most stupid person in the world, because you should have taken the professional help, or you should at least take it now. The time that you are wasting and you are creating blunders or errors, patients are not stupid. They will definitely understand that something odd has happened, and when they will visit other type of dentists who are more confident, who are accurate, okay, or either they have a more experience than you and made some stupid mistake and then learned, or they have learned it already from some professional, or they have a good mentor and they have learned, then definitely you will lose that patient for life. Okay, so please keep this into mind, that whenever you are facing problem with any type of dental treatment in dentistry, smart decision will be to learn it from the people who are expert in that. Okay, that is my see, we are having our academy, and that is why I'm saying this to you. It's not right. Okay, I have suffered it myself. There was nobody to teach me, or at least force it on me, that you are making some mistakes, and I have lost some important years of my life. And later on, I had to spend money, I had to get an education done, but it improved my dentistry drastically, and that is why I was able to shift from one dental clinic to three dental clinics. Okay, in working a smarter manner. So you need to do the same thing. Okay, wherever you connect with anyone, you feel like you get their mentorship and you learn from them, then you become successful sooner, better, and in the easier manner. Okay, I will like to end this discussion over here, otherwise I can keep on talking about it. Okay, so that's all from me on this part, but yet still I have a small video clip of unboxing of this Sofu resiglass, just to make you familiar with the product. So have a look at the video part, okay, and then see you at the end of the video. So doctors, as you can see on your screen, this is the packing of Sofu high bond resiglass. Here is the tags and pricing and the manufacturing details written. Okay, so this is the packing of it. We are going to open it up. Okay, it is available in a powder and liquid form. That makes it easy, or easy to manipulate for us, or better than a clicker system. Ideally clicker system is better, but since we are trained long using powder and liquid for cementation, I think it is little bit more easy to accept. That's all. So you get a very important page, and that is this instructions. Those are the most important content of any packet. You should form a habit of reading them out. You get a mixing pad, as you can see, and there is a powder bottle, and this is the liquid bottle. It was smartly placed inverted, and whenever you store your any type of GIC or liquids, you should always store them in inverted position like it was over here. You get a scoop which has two measurements, one number one size and number two size. It can be helpful to you in cementation of smaller or 1 unit or 2 units. Here you can see the details. The powder is 15 gram and the liquid is 10 gram. Okay, and it is a sufficient quantity. You can see it is bigger than my thumb size, and around 3/4 of my finger size. Okay, so you can do a lot of crown cementation. There are different ratios mentioned. I would recommend you to follow 1:1 ratio. Okay, for single crown, and 1:2 ratio for bridges, etc. Okay, it is available in a seal pack form. So if I'll try to open up the cap like this, you will be able to see it is sealed, and that is a very good thing. The liquid bottle is tightly packed. Okay, and it is a dropper type of a bottle. Okay, so you don't waste much of a liquid, as you can see. Okay, so it is a limited drop type of bottle, and you don't waste it. Okay, so these are some of the details, and you must form a habit of reading this paper in every product you buy. The most important part will be direction for use. You can never miss on this, how to use this material, and what is the mixing instructions as mentioned over here. Okay, I would ideally recommend you to read everything, and it will always give you more insights about the product. Okay, so doctors, this is all on luting cements. Okay, and I hope this was an informative one for you. Still, if you have any queries or so, put your questions down in the comment section, and we'll try to answer it for you. Better join our We the Dentist community, and we can answer n number of questions you have related to dentistry. Okay, and especially for the doctors who are planning their new dental clinic, it is a must group for you, because we already have more than 800 members, and almost every member is a new dental practitioner. We have some experienced dentists also who give expert answers to solve out your queries. Okay, many things we do under this community. Every Sunday we organize one or the other conference or lecture. Okay, this Sunday we had a discussion about electrocautery, and also about bleaching, and then we had a discussion about how to place orders safely to avoid from fraud and all those things. So be a part of this community, and it will definitely help you out in many ways you cannot think of. Okay, so doctors, that's all from me on this topic. See you all in yet another interesting video. Until then, stay tuned to the channel. Thank you.